One other thing that I forgot to forgot to touch upon was other wound-related complications. So not like a flap loss or partial flap loss or anything like that, but just where we put things together, wound separation and things like that. Those things are extremely common.
Right.
And those things are again typically managed by wound care, local wound care, and just patience, tincture of time. The donor site, if we, for instance, take flap tissue from the forearm for a radial phalloplasty, that donor site, you can have pain, numbness, some restriction of wrist motion. The restriction of wrist motion, typically, we are proactive about limiting that. So we have patients start on occupational and physical therapy for hand exercises. They can have some sensation loss in the back of their hand because there are some nerves that we move out of the way. And just by us touching and moving them around, they can have some temporary loss of sensation. If that happens, that typically comes back in about 6 months or so. Phalloplasty, it's the toughest surgery that anyone will recover from. It's a high risk, high reward surgery. For patients who undergo all steps of the phalloplasty, who have complications, bumps in the road, but elect to have reoperations or repeat surgeries to address those complications. I'm not specifically talking about radial forearm phalloplasty. The satisfaction rate is close to 90%. 90% are able to pee from the tip of the penis, assuming they have had multiple surgeries to repair any fistulas or strictures that they would have had. Most of them have sensation within the penis that is erogenous, so with sexual stimulation, as well as somatic, so pressure, hot, touch, cold. It may not be uniform all the way to the tip of the penis, but it may be patchy in some areas, but most of them do have sensation. And for people who elect to have an erectile device placed in the penis, they're able to use that for penetrative intercourse too. Although some patients don't elect to have an erectile device and are still able to use it for penetration, just wrap a Coban and condom around it. There's a device, I don't want to endorse any devices, but there's a device on Amazon. What is it called? Aerator or erector device? It's like an empty silicone, like a hollow silicone cylinder that you put the penis in,
Sure.
and then kind of use that for penetration.
Like a sleeve.
Like a sleeve.